Lisa Lapointe says illicit drug toxicity is the leading cause of unnatural death in British Columbia, accounting for far more deaths than homicides, suicides, motor vehicle incidents, drownings, and fire-related deaths combined. So we're really glad you're here and that you're willing to learn how to respond to an opioid overdose. Hi, my name's Christina. I will be training you today in how to respond to an opioid overdose. This is the Opioid Overdose Survival Guide. This is what we're going to be going through. You're going to learn what is an opioid overdose, the contents of an naloxone kit, signs of an opioid overdose, and of course, responding to an opioid overdose. But also, I'm going to teach you a little bit about what to expect after you respond to an opioid overdose, so buckle up, here we go. So what is an opioid overdose, you ask? Well, let me tell you. We have breathing receptors in our brain, and opioids come along and attach to breathing receptors, thereby suppressing respiratory function. And what naloxone does is it comes along and it goes in between that opioid and the breathing receptor, restoring respiratory function, allowing the person to breathe again. So to summarize what an opioid overdose is, opioids are depressants. They suppress respiratory function simply by attaching to breathing receptors. So the most important thing you can do during an opioid OD is to administer breaths every 5 seconds, and don't forget to pinch that nose. Brain damage happens pretty quickly. So let's talk about the contents of a naloxone kit. If you have longer hair, always carry a hair elastic in your kit. You'll be thankful that you did. You should tie your hair up every time you're going to respond to somebody. That way your hair won't drag across anybody's vomit or anything of that nature. Every kit comes with a pair of gloves, and I'm going to recommend that you change those gloves out and replace them with a pair that fit you very well. These are an extra small size so that the gloves don't dangle over my fingertips. It makes responding more difficult when you're trying to peel a needle with big baggy gloves. It doesn't work well. So put on a pair of gloves that fit. This is the naloxone. It comes in an amber-colored container with amber-colored glass because they are heat and light sensitive, so we never leave naloxone in a car. It comes with 3 ampules. This is an ampule breaker. Never remove that when you're going to respond to an opioid overdose. You need that to break the ampule. We've also got 3 vantage point needles in every kit. We always open the needles from the orange side, just remember that, and keep the cap on when we remove the needle. That needle is very sharp. It'll go through many layers of clothing, so you don't have to worry about naked skin. Super sharp. But the needle is designed to disappear when you push the plunger all the way down. See, it's gone. It's disappeared into the barrel. That's so that no bloodborne pathogens will affect you, like you don't have to worry about getting poked and contracting HIV or Hep C. And then we've also got this one-way valve breathing mask. Okay, so this is the star of the show. Every 5 seconds, you're going to administer a rescue breath, so this is going to protect your face from touching that person's face. Okay, so we put that part into the person's mouth and make sure you pinch the nose and open up the airway before every breath you give. And we're going to go over that more in a little bit. Just don't forget, you got to create a good seal around that blue piece and push your air in. Takeaways from contents of a naloxone kit. Always wear gloves that fit. Tie your hair up if you have long hair. Don't leave naloxone in your car. Vantage point syringes have a needle that will retract into the barrel, and a one-way valve breathing mask protects you from air, vomit, and saliva from the person you're rescuing. Naloxone ampules can be difficult to open, so here are some pro tips to help you out with that. I want you to hang on to the plastic ampule breaker and turn the glass ampule 1/8 of a turn. So I want you to turn it, try and snap it. Turn it, try and snap it. Turn it, try and snap it. And eventually, it's going to break for you. Use the lid as a table so that your naloxone doesn't roll away. And when you go to stick the needle in, make sure that you don't pick up the ampule because you can poke that needle right through your fingers and do some nerve damage, and we don't want that. So put the ampule down, stick the needle in, and slowly, but not too slowly, I want you to slowly draw the medication up. You'll hear a little like a gurgling sound, and then you're going to flip the needle over and push the air out because it is intramuscular. So you don't have to worry about pushing all that air out because it's not intravenous, okay? And then you're going to inject into a large muscle group, so the person's butt cheek, into their thigh, or into the shoulder if you have to. How to break a glass ampule? Never remove the plastic ampule breaker. Swirl it, then give it a little flick so that you can attempt to get all the medication down from the top of the ampule to the bottom. And then hold the ampule by the breaker and turn the glass 1/8 of a turns while you're trying to snap it, and eventually it's going to snap. There is a sweet spot. There's a tiny little silver dot on the ampule that's hard to see, but it is there. Signs of an opioid overdose. So, a person is not moving and they cannot be woken up. They could be experiencing slow breathing or no breath at all. And some people, but not everybody, they make a snoring, gurgling, or choking sound. The whole body could be blue or dark purple, and the skin can be cold and clammy. You're going to notice that the lips, around the lips, the tip of the nose, and the fingertips are the first things to go blue. And that's because our body pulls away all that oxygenated blood to protect our vital organs all in the middle here. So we don't do chest compressions in an opioid overdose when there is a pulse. So we're going to check for a pulse. And if there is a pulse, we do not do chest compressions. And if a person can respond to you in any way, they're not overdosing, we just walk away. Walk away. So important that you know how to check for a pulse, because we don't do chest compressions when there's a pulse. Pull the person's arm out straight. Place your index, that's your pointer finger, and your middle finger on their wrist at the base of their thumb. And never take a pulse with your own thumb because your thumb has its own pulse. So to recap signs of an opioid OD, a person is not moving and can't be woken up. They have slow breathing or no breath at all. Their lips, fingertips, tips of their nose, or their entire body could be blue or dark purple. And some people make a gurgling, snoring, and choking sound. But if somebody can be woken up in any way, we just walk away and leave them alone. They are not overdosing. So I'm going to show you how we respond to an opioid overdose. And I've got some great pro tips here. And one of the pro tips is that you're trying to wake somebody up, and a great way that to get somebody up is to tell them that hey, I'm gonna have to Narcan you or naloxone you if you don't wake up, and I don't want to naloxone you. Please wake up. So the first thing you're trying to do is wake somebody up. You're gonna make sure that your gloves are on, and you can stimulate the person by rubbing your knuckles on their sternum. You can clap in their ears. What I like to do is, if I'm approaching somebody who is on the street, I prefer to just wiggle their foot with my foot. This is our mannequin Steve, and Steve has no legs, but we're just going to pretend that he does. So I would come up to Steve on the street, and I would just wiggle his foot with my foot, trying to wake him up. The second thing that we're going to do is if they're unable to be woken up at that point, and we can see that there's some blue around the nose forming or around the lips, or perhaps the person is already blue or purple, in which case the most important thing we can do right now is give breaths very quickly. We need to give breaths. Remember, we don't do chest compressions when there's a pulse. So amongst all this, you've also got to check for a pulse. So we're going to shout, I'm going to naloxone you and I don't want to, I need you to wake up, please wake up. And they're not waking up. I'm going to check for a pulse. And Steve has a pulse. So at this rate, we're going to open up our kits and we're going to start administering breaths straight away. So you want to remember, be sure to tilt the head back every single time you give a breath, because we've got to open up that airway. So you're going to give a breath every 5 seconds, and I'm going to urge you to count aloud. 1, 2, 3, 4, 5, and then you give a breath. You have to make sure that you pinch the nose and tilt the head back to open up the airway to give a breath. This is really important. Otherwise, that important oxygen isn't going to go in effectively. So we want to make sure that we give breaths every 5 seconds. Don't forget to pinch the nose and tilt the head back with every breath that you give. So a great pro tip for you is to make sure that you say each step out loud that you're doing. The reason that we do that is at this point you could be experiencing some stress, and sometimes in traumatic or stressful situations our amygdala gets hijacked, and just to keep yourself calm, I want you to say every single step that you're doing out loud in a very calm and soft voice. This helps, again, to keep you less stressed, but also if Steve doesn't make it, and if he can hear you, the last thing he's going to hear is a nice calm voice. I always call myself friend, refer to myself as friend when I'm responding to an overdose, and that means that if Steve can hear, Steve is also hearing me call him friend. So that's why we do that. We're going to prepare the naloxone between giving breaths. It doesn't make any sense to prepare the naloxone while somebody is suffocating to death, essentially, right? So you're going to prepare that naloxone between breaths, and you're going to inject into the thigh, into the butt cheek, or into the shoulder if you have to. So it's an intramuscular needle that you're going to inject into the thigh, butt cheek, or shoulder. If there's no response after about 4 minutes, you're going to give another dose of naloxone. And just remember that that needle is going to go through many layers of clothing, so it's not important that you get it on bare skin. Yeah. So while you're continuing those breaths every 5 seconds, you're going to roll, once the person is able to breathe on their own again, so we know the naloxone has worked because respiratory function has been restored. So Steve's color is now coming back. I can see that his chest is rising and that his belly is like he's breathing. And what we're going to do when Steve starts breathing again is we're going to roll Steve into a recovery position. And if you look at the diagram here on number 4, you can see that we're putting Steve's head onto Steve's arm like this so that if he vomits or anything, he's not going to choke. So we just roll him onto his side and make sure that his head is resting on his arm. And that will give him some space in case he vomits or anything. Once the person is breathing on their own, we move them into the recovery position. Naloxone wears off in approximately 20 minutes. So it's anywhere from 20 to 90 minutes. And we're going to stay with that person to make sure that they're not going to need more naloxone. So let's recap responding to an opioid overdose. First, we try and wake the person up. We wiggle their foot with our own foot. We clap our hands near their ears. We can shout at them, "Are you okay? Wake up." Or, "If you don't wake up, I'm going to have to naloxone you and I don't want to." We also make sure that we check for a pulse when we call 911. If the person has a pulse, we bypass chest compressions. And when you tell the 911 operator that you will not be performing chest compressions, they will bypass that too. And most importantly, make sure that you calmly say the steps you're taking out loud. You got to take care of yourself. Try and take care of your mental health by keeping yourself calm. Further, we perform rescue breaths every 5 seconds, where we remember to pinch the nose, tilt the head back to open up the airway, and we make sure that we prepare the naloxone between breaths. It makes no sense whatsoever to allow somebody to suffocate to death while you're fumbling around with a naloxone kit, okay? So breaths every 5 seconds, count them out loud. 1, 2, 3, 4, 5. We inject the naloxone into the thigh, butt cheek, or shoulder. And we roll a person into recovery position once they are breathing on their own. Hey, wake up. Hello, are you up? Wake up. Wake up. I got no response. I see your nose is going blue. Oh dear friend, it looks like you need some oxygen right now. The first thing I'm going to do is check your pulse. You have a pulse, so I won't be doing chest compressions on you, but I'm going to give you breaths right away because you're starting to go blue here. One, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Okay, Steve, I'm just trying to get your needle open here. Oh dear. All right, friend, I've got you. We're going to walk you through this. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Hang on, friend, I'm almost there for you. I'm almost there. I'm going to inject your first dose of naloxone here. It's going to push the air out, and I'm injecting right into your butt cheek. One, 2, 3, 4, 5. 1, 2, 3, 4, 5. There's an update from the BC Emergency Health Services 911, and they sent us a practice update. So when you call 911 and this person has a pulse, then we don't do chest compressions, and the call taker on the other side will actually omit that part of telling you to give chest compressions, so long as you say the script that's on here. So you just let the person know at 911 that you have checked for a pulse, the person has a pulse, and the person, you will not be doing chest compressions, but you're going to be giving air every 5 seconds, so you might not be able to talk and respond to them. Pro tip 2, keep your phone on speaker and maybe stick it down your shirt, or if you're wearing a hoodie, stick it in here, or between your knees, because you're going to be kneeling, because you're going to be giving the person breaths. So you won't be able to talk to the 911 person, but you will be able to count every 5 seconds to give your breaths. And remember, we don't do chest compressions when there is a pulse. And here's what you can expect post-response. Sometimes a person can be angry with you. They may even lash out at you verbally. Not always, but sometimes. Just remember that it's not personal. This person may be experiencing precipitated withdrawal, and they're probably feeling pretty awful right now. So don't be surprised if the person uses drugs upon coming to from the overdose. And you may feel like crying or upset of what you've just experienced, and that's completely okay and completely normal. Make sure, though, that you debrief with somebody that you trust. Don't compartmentalize this experience for the sake of your own mental health. Please, take care of you. And this is very important post-response information, so take note. You have to let the person know that they may be experiencing precipitated withdrawal and that the naloxone is going to wear off in 30 to 90 minutes. And without judgment, remind the person that if they do use again, that they are at risk of overdosing again when the naloxone wears off. The person will likely be feeling pretty awful because withdrawal symptoms are dreadful. On behalf of the Purpose Harm Reduction team, bye, and thank you very much for joining our naloxone training. Psst, P.S. You know, it's ideal for people to learn naloxone training in person. So if you are an individual or a group, corporate, or community organization, Purpose Society will drive to you to train. Training is free and kits are free of charge, although we really do appreciate donations and tax receipts are available. Remember to donate to the harm reduction program if you're able. Thanks so much. Take care. The Purpose Harm Reduction team based this training video and the training manual on their years of experience of overdose reversal and best practices. We are not medical personnel. Purpose will not accept any liability that may flow from your use of this video. Thank you for watching.